For today's Health in Focus, we're talking about brain tumors, but kind of a different kind of brain tumor than one might normally think of. We're with board-certified neurosurgeon Dr. Jay Jaganathan. Tell us about, we're talking benign brain tumors, so tell us what that is.
So when we think of tumors, we usually think of cancer, which basically means that it's a disease that can spread from one part of the body to the other, and it's a disease where the cells divide quickly and can often grow extremely large very quickly. Benign brain tumors usually are confined to a single location, but they are capable of growing. Even though they grow slowly, they can grow over time and cause symptoms.
Okay. And what brings this on?
There are a variety of genetic conditions that can, and in some patients there's a strong family history where multiple members of the family have it. Oftentimes it's sporadic, meaning that we don't really know why they come in, but it's important to know that they can be common. I mean, up to 25 to 30% of patients, when they do autopsies, have some type of benign tumor that's present that they may not have known about their whole lives.
Wow. What are the symptoms?
So symptoms, to a large part, depend on size and in terms of where the tumor is located. Common symptoms when the tumor grows really big are going to be severe headaches, weakness, nausea and vomiting. Oftentimes these tumors can grow around nerves, which can cause double vision or blurry vision. And some tumors that people are fairly commonly aware of are tumors that form the pituitary gland, so they can cause hormonal dysfunction, things like weight gain, weight loss. They can cause excessive growth or lack of growth, and problems with energy and things like that.
Okay. I mean, that's a lot of kind of common symptoms. How do you nail down that this would be, I mean, you don't want to alarm anyone, but how do you figure that out?
The first thing is to get medical attention. Talk to your primary care physician very frankly about the symptoms. I think if there's concern for pituitary tumors, getting studies of the hormonal function is very important because that'll tell you if there are abnormalities there. I think keeping a very close eye on your symptoms, especially if they're progressing, is important. The important thing with benign tumors is oftentimes they can be treatable, but when they get extremely big, the treatment can get a lot more difficult. So it's important to catch them at an early enough stage.
Okay, and you mentioned treatment. What are the treatments?
Several treatments. I mean, most commonly when these tumors are caught small, they can just be observed, which means that you just observe it and make sure it's not growing too quickly. There are some non-invasive treatments, such as focused radiation. The gamma knife is kind of the classic treatment where the tumor can be selectively radiated while sparing the rest of the brain. And then in severe cases, surgical treatments when the symptoms are either are getting worse or when the tumor is not responding to non-surgical treatment can involve going in and removing the tumor as a single piece.
And that could be pretty invasive.
That could be pretty invasive, but there are less invasive ways that are out there too, but usually that would involve a more involved stay and oftentimes an ICU stay and stuff like that after surgery.
All right, thank you, Dr. J. If you want some more information about what a benign brain tumor is and how it's treated, you can always head to our website, 9and10news.com.
This Health in Focus is a paid segment by Jaganathan Neurosurgery.